Hello and welcome to the Healing Quest. I am Kate Ellis. I am a clinical counseling hypnotherapist specializing in anxiety, panic attack, permanent correction. If you are contending or suffering with anxiety or panic attacks, let me tell you, they are very easy to correct. I've created a protocol that will eliminate them permanently from your life in 3 sessions. As a matter of fact, after the very first session, you will never have a full-blown panic attack again. I can't even count on my one hand in the over 24 years that I've been doing this that anybody's ever had a full-blown panic attack afterwards. There are a few exceptions, but it's extraordinarily rare. So if you're having these issues and 1 out of 4 people are, or to put it into a broader context, 117 million Americans suffer with a panic or anxiety attack, at least at this time that's going on. You know somebody who's having issues with this. This particular installment of Adventures of a Hypnotherapist, some of my unique and strange stories, is kind of an embarrassing story for me as a hypnotherapist. I had a client that I had worked with for other issues, and he came to see me because he knew I did pre-surgical hypnosis. And what pre-surgical hypnosis does is, because the subconscious mind controls the autonomic or sympathetic nervous system, which is your bleeding, your heart rate, your breathing, and other attributes, what I can do is I can suggest to your subconscious that when the surgeon makes the incision that there'll be little or no bleeding, that when the anesthesiologist gives you the anesthesia in order to knock you out for the surgery, that not only will you easily tolerate it, and as well as you will detoxify from the anesthesia very quickly after the surgery. Sometimes this can be problematic for people, as well as reduce pain. I have a desk drawer full of prescriptions of pain medications that they did not need to take after their surgery. And this is more common than it is unusual. So this client was going to have foot surgery, specifically bunion surgery, and if you're unaware, this is one of the most painful surgeries that a human being can have, all the nerve endings in the bottom of the foot. The surgeon didn't tell him it was going to be very painful. He simply said that there's going to be a good 6 to 8 weeks of recovery of this, and I wasn't going to tell him. I certainly wasn't going to plant that seed in his brain. So he came to me, and I did the 2 sessions that it takes for this for him, and then seen him about 3 weeks later, and he comes into my office yelling at me. He goes, "You got me into trouble, you got me into trouble," and I don't take kindly at being yelled at. I'm like, "Sit yourself down and calm down. Now tell me what happened." I says, "How did the surgery go?" And I thought it was kind of unusual because he walked into my office and he didn't have crutches. So I said, "So how did the surgery go?" He says, "Oh, it went fine." He goes, the surgery went very quickly. The doctor says, everything went fine. He says, "After I woke up in post-op, I had to go to the bathroom." And so I looked, and I seen ahead of me that there was a bathroom across the hallway. So I get up off the gurney and I start walking towards the restroom, and a nurse turns around and starts yelling at me, "What are you doing? What are you doing off of your bed?" He's like, I just got to take a leak. And she goes, "Let me help you out. Are you in any pain?" And he goes, "No, I'm fine." And that could be from the anesthesia that was still in his body. And so he recovers there for a few hours and goes home. A week later, he has his post-operative review from his surgeon, and he goes walking into the office, and the surgeon is busy doing some paperwork and looks up and sees my client and goes, "What the hell are you doing?" He's like, What? He goes, "Where are your crutches?" He goes, "Oh, I didn't need them, and by the way, here's the script back for my pain medication. I didn't need it." Well, the surgeon was very concerned and puts him up on the examining table, examine his foot, and the client is just having a hoot with this, messing with the poor surgeon's mind. And finally, he says to the surgeon, he goes, "I'll tell you what I did, Doc. I seen this hypnotist, and she hypnotized me so that I would go through the surgery well." And he goes, "You know what? If that worked for you, great. Use the crutches, don't ruin my work, because I'm going to be seeing you in another 6 months for the other foot." Now, as a hypnotherapist, and why this is embarrassing somewhat to me, is that you never turn off the pain signals for somebody. What is pain? It is the body's signal telling you that there is something wrong for you to attend to it. So as a hypnotherapist, that's why we never, ever block 100% of the pain signals. And you're able to do that. Think about pain as a volume control, and when you're in pain, it's the number 10. And as a hypnotherapist, I can help you at the subconscious level to turn down the volume of that pain until it's at a place that is tolerable for you. Again, you never want to get rid of the pain. Now, how this client had interpreted what I had stated to his subconscious, I do not know. I'm very careful from this day forward with that. However, he interpreted it as experiencing no pain, and that's exactly what he did. Again, as I've said in many of these episodes of Adventures of a Hypnotherapist, I am never been failed to be amazed by the plasticity and flexibility of the human mind, and for your mind to create a condition as well as uncreate a condition. You are an unending horizon. You have every potential. You simply have to get out of your own way and believe in yourself. One thing that people do incorrectly is they think about what they don't want instead of what they do want. So my suggestion to you for the day is to think about what you want and all the different ways that you may achieve this. Don't worry in the manner in which it comes. It will manifest in some way, shape, or form in your life if you believe in yourself and if you're confident in yourself. And number one, you trust yourself and you trust your life. You are an unending horizon. Thank you for your time. I'm Kate Ellis. I look forward to visiting with you again for another episode of Adventures of a Hypnotherapist. You may contact me at thehealingquest.com. I'm located in Scottsdale, Arizona in private practice. However, don't allow that to impede you. I am available for Skype sessions, and they're very successful. Thank you.